Hello, this is Miguel Arrieta, and I'm doing my evidence-based project for nursing research. So this is the table of contents, and this is the back. I'm going to talk about the background, aim and purpose of the study, methods, design, procedure, method, setting, and example, results, and the discussion. So a bit of background on me is I am a night shift nurse in the intensive care unit, and I always see a lot of patients in my unit unable to sleep a lot. They often become very delirious during their stay in the hospital because of the amount of work that we have to do during the nighttime. And I believe that looking into sleep and promoting sleep interventions can hopefully help my patients, and maybe I can educate my fellow nurses as well in the hospital. So, quick background: sleep is a very complex subject because it is the body's response to recovery and rest. There are multiple stages of sleep, such as light sleep to REM, rapid eye movement. Having adequate amount of sleep can shorten recovery times, lower chances of delirium, and can increase their mood while in the hospital. Not having enough sleep can be detrimental to the human body. According to Ritmala Castron, consequences of sleep deprivation include increased stress, pain, mood disorders, cognitive and performance deficits. According to an article written by King et al., poor sleep is a primary source of stress for intensive care patients. Sleep dysfunction in the intensive care unit can increase hospital delirium, increasing hospital stays. According to Edvardsen, poor sleep quality in hospital can develop sleep disturbances even after a year being discharged from the hospital. Patient satisfaction is related to hospital reimbursement, according to the Affordable Care Act. Therefore, hospitals are given a score based on the patient's hospital stays, and they get reimbursed based on that score. The aim of the study is to determine if interventions aimed at promoting sleep can increase sleep quality for patients in the intensive care unit. By promoting sleep interventions, it can increase the patient's sleep quality. Therefore, it can reduce the length of stay, lower incidence of delirium, and increase patient satisfaction. Therefore, PICO question is as follows. Does implementing interventions dedicated to promoting sleep compared to no sleep promotion increase patient sleep quality and satisfaction during their stay in the intensive care unit? So, methods, design, and procedure. I did 4 quantitative research articles and 2 qualitative research articles. Their design and procedure is as follows. So, Ritmala, Castron, they did a quantitative design that involved a 2-group intervention study. And the procedure was the interventions were created by identifying sleep disturbing factors and implementing sleep interventions based on the factors. The patients were asked to complete a Richard Campbell sleep questionnaire. Kamdar et al. Did a quantitative research design that involved data collection methods such as Richard Campbell sleep questionnaire. RAS and CAM ICU scores were used. Sample population were also evaluated after being in the intensive care unit. Richard Campbell sleep questionnaire, just want to point that out. It's used a lot in sleep studies. Basically, it just asks the patient a variety of questions based on their sleep quality, and they get a score based on that. So, for procedures for CAMDAR, the research project was done in the intensive care unit. One group received standard care with sleep promoting interventions. The control group received standard care with no sleep promotion interventions. Huang et al. Quantitative research design that used methods of data collection such as a polysomnography test. Patients were also observed on their sleep along with questions pertaining to sleep quality. They also were given melatonin during this procedure, and they were drawn blood on the melatonin levels to determine whether or not melatonin in their body, their levels were going up or down. Um, Procedures is the patients are in the sample population were given sleep promotion interventions such as sleep masks, earplugs, and introduced oral melatonin. Melatonin blood levels were taken throughout the night to determine melatonin levels. Anxiety tests were also taken by the use of the STAI, which is the Spielberg test for anxiety. Methods, design, and procedure continued. Patel et al. Did a quantitative research design that involved patients in the intensive care unit. Methods used to obtain sleep quality include the Richard Campbell Sleep Questionnaire, CAM-ICU tool, and RASS. Just letting you know, RASS is the Richmond Agitation Sedation Scale, which a lot of intensive care units use to monitor their sedation. Their scores range from +5 to -5, and it's based on how the patients are doing with their sedation. So if they have a negative score, they're more sedated, and then if they have a positive score, they're more alert and they're very restless. So the procedure for Patel is the research consisted of intensive care patients that were given a multi-component bundle of interventions that is used to reduce noise, light, and sleep disturbance. Baseline data was gathered prior to the interventions being done. So if you look at the picture there, before the multi-bundle of interventions, in 1st of June to June 24th, they were grabbing all their data, sleep data, environmental data, and delirium data. They did a 21-day break in the ICU, and they did all the interventions, they implemented them, and then after they implemented the interventions on the 21-day break, they started recording data collection again. The two qualitative articles is the Geller-Stet, and which is a qualitative descriptive research design that interviewed an emergency and intensive care nurses in an acute hospital to determine what experiences they have in regards to sleep promotion and priorities. The research group consisted of nurses divided into 4 focus groups that were interviewed. Several nurses were then picked after the initial group interviews and were interviewed separately based on the findings. Data was then analyzed using qualitative content analysis. Lewandowska qualitative research design that used phenomenology, a research method to understand the patient's experiences in the intensive care unit. The researchers used a semi-structured interview in the intensive care unit. Patients were questioned on their nighttime habits and sleep. Answers were then recorded and transcribed, and then they were coded and cross-processed. Methods, setting, and sample. Ritmala Castran, her sample is the sample is taken for 4 different wards in a 400-bed acute hospital. The participants needed to be at least 18 years of age, able to speak and write, slept at least 2 nights in the ward, and used a visual analog scale. Camdar used the sample populations from Johns Hopkins, took a sample of 300 patients, and 122 received baseline care, and 178 patients received care with sleep quality interventions. Huang et al., the study included a sample of 40 test subjects that were greater than 18 years of age and had a normal sleep pattern according to the Pittsburgh Sleep Quality Index. Test subjects did not have any history of sleep-related disorders and were not allergic to melatonin. Patel et al., population is obtained by acquiring patients that are going to be admitted in the intensive care unit after the operation. Test subjects used did not have any cognitive dysfunction or sedative before the study. Researchers questioned a total of 167 patients for the study. Geller-Stet research setting sample included 22 nurses in an acute critical care environment such as the emergency department and intensive care unit. And they did those focus groups and the separate interviews as well. Lewandowska, 23 patients, 15 men and 8 women from medical and cardiac intensive care units are used for the study. Average hospitalization stay was 33.4 days. Patients were given verbal consent for the procedure, and patient criteria includes patients who stayed in ICU for 7 days, and the 7 days include no pharmacological intervention. So the results of the studies. Results of the quantitative studies do show that sleep quality has a significant impact on patient well-being in the intensive care unit. Multiple factors such as noise, lighting, and frequent awakenings can increase the chances of hospital-acquired delirium and decrease sleep quality. Ritmala Castrin states that the patients with sleep interventions had a slightly higher RCSQ, Richard Campbell Sleep Questionnaire, score than the patients who received standard care. Wang et al. States that using interventions such as sleep masks, earplugs, and introducing oral melatonin significantly increased patient sleep quality and reduced incidences of delirium in the intensive care unit. So for the results of the qualitative studies is as follows. Gellerstedt states that nurses in the intensive care unit and emergency department do not prioritize patient sleep, and that sleep is not emphasized enough in acute care. Nurses are not educated enough on the importance of sleep interventions. Lewandowska states that anxiety plays a factor when sleeping in the intensive care unit, according to the patients. Factors such as light and noise can interrupt the sleep cycle. Identifying the patient's sleep pattern and reducing distractions can help prevent patient fatigue. Significance of findings related to nursing. Promoting sleep intervention significantly increases patient sleep quality while they are in the intensive care unit. Nurses that are tasked with taking care of patients at night should implement interventions such as sleep masks, earplugs, and cluster care to reduce interruptions. It is important for nurses to be educated on the importance of sleep in the acute care setting, as nurses do not prioritize patient sleep in the hospital, which is true to some extent in the intensive care unit where I work with, at least. There's a lot of blood draws, Q6, or if there's a NIH stroke scale that we have to do, you have to do that every hour for 16 hours and to monitor the patient if they've been given TNK or not. So there's a lot of distractions and a lot of interruptions on sleep, and unfortunately we have to educate these patients on the procedures that we have to do because it can be life-saving as well. So, Peacock question. After researching, does implementing interventions promoting sleep in the intensive care unit increase patient sleep quality and satisfaction as compared to no sleep intervention? I do believe implementing sleep interventions such as eye masks, earplugs, and reducing interruptions does increase patient sleep quality in the intensive care unit. So it does answer the question that implementing these sleep interventions does increase patient sleep quality in the intensive care unit. However, there is more research to be done on the importance of sleep promotion in the hospital setting, as many nurses are not educated enough on the importance of sleep. There is also not enough research if sleep can impact patient satisfaction in the hospital setting, which means the scores on the hospitals for sleep and their patient satisfaction. There's not enough studies to correlate on that as in the intensive care unit. Conclusion: sleep is an important function for the human body. Patients in the intensive care unit often have their sleep interrupted, causing delirium and increased recovery times. Nurses tasked with promoting sleep interventions to patients as compared to standard care result in increased sleep quality and reduced incidences of delirium. More research and education should be done for nurses, as sleep is often overlooked when doing patient care. And these are all my references. Thank you for listening.